Mansfield today on a Wednesday. Nice to have you with us, and nice to have our resident GP, Dr. Vicky Skitter, with us once again. Hello, Dr. Vicky.
Hello, Jeremy.
You're looking very smart.
Glassy.
Yeah. You're looking like a medical professor.
Yeah, with my clever look.
Yeah.
I try.
You see, now I've also got my glasses. We've just finished eye health month.
Yes.
Yeah. So we both got our glasses. You see, mine are very different to yours, because mine are designed for television.
Yeah.
Yeah.
Okay.
You see, so you can hardly see them, but I can take Skinner looks down at my notes here on my computer. You see, it's that easy. We have a guest today.
Yes.
Who is an ophthalmologist, Dr. Dori Noina from the Fourways Life Centre. Dr. Dori, thank you very much for joining us. Nice to have you with us.
Thanks. Nice to be on your show. Hello, Vicky.
Hello, Dory.
Okay, so I've got to call him Dr. Dori. You just saw me Dori.
Yeah.
Oh, no,
Okay.
no, you can call me Dory as well. Okay.
Right. We can now say we found Dori. You wanted to ask something about glasses. And
the reason
you see, the blonde in you comes out every time.
This is, not a real blonde, but I wore my glasses today because I suffer from presbyopia. That's the medical name for old age. So, yeah.
Oh, somebody's lying to you. Your optometrist is lying to you, doctor.
So I've got about 5 pairs of glasses lying around in my house, and whenever my kids push something in front of my face and say, "Mommy, look here," I go like, "I cannot see, just put it far away," and it irritates them. So maybe Dr. Dori can give us a quick rundown on
Absolutely,
why
and you're starting to reveal your age by the number of glasses you have lying around the house. So this is quite normal, and this happens to all of us as we get older. If you think of your eyes like a camera, and it's got a lens, and that lens has got an autofocus ability. So when we're young, we can look far, and then we can focus on things up close to us. But when we get to our mid-40s, that autofocusing starts to diminish, and so we start to not be able to focus on things right close to us, and we have to hold them a little further away. People get the feeling that their arms are getting a bit too short, and it's simply because your eyes are starting to age. It's a milestone in the aging of our eyes in our mid-40s, and this happens to everyone. The only people who are maybe spared from this are those who have a little bit of short-sightedness, and they can see things closer better than the rest of us. But this happens to all of us, and it's quite normal, and there isn't much we can do about it at the moment. And I'll say at the moment because there's always things in clinical trials, eye drops and drugs, which people are trying to reverse the aging of the lens inside our eye. So what happens is in our mid-40s, we start to sort of have to hold things just a little further away just to try and focus on them. When we get to 50, our arms gets a bit shorter and we have to hold things a little bit further. And then by the time we get to our mid-50s, early 60s, that process is now stopped and there's no more aging in that lens, but you really can't see things very close without glasses. So yes, this is quite normal, happens to all of us. At the moment, not much we can do about it from a medical point.
Okay, but then are you saying from about the age of 60 onwards that's sort of it? That's where you're going to be for. So
that's it. Your arms get as short as they're going to get, and then it doesn't get worse. So it's not something that sort of progresses every year. It has a finite process from about the age of 45 to around about 55, 60.
Yes,
that's why the reading glasses only go from about your reading glasses, when you buy them off the shelf, you only get to about a +2.5, +3, because that's where most of us will end up.
Okay. So there's really no sort of general eye health that you can use to offset or improve or delay this process. It's going to happen.
That process, presbyopia as we call it, or sort of that lack of losing that accommodation, there's not much we can do about it. It happens to all of us. But certainly from an eye health point of view, there's a lot we can do to prevent other degenerative diseases of the eyes and to allow for sort of a more healthier sort of eye as we get older. You know, people underplay the importance of sunglasses, for example. Sunglasses are something that will, and it's the UV protection that we want. We want UV protection for the inner structures in our eye, the lenses in our eye, and the retina to prevent degenerative diseases later and to slow the progression of what we call a cataract, which is something that happens to us in our mid-60s when the lens starts to go cloudy. Sunglasses are also important in protecting your eyelids from ultraviolet light. Skin cancers on the lower eyelid are one of the most common sites to get skin cancers, and it really is something that's underplayed. So good pair of sunglasses from a young age. There's no reason why even our children shouldn't be in sunglasses when they're playing outside. We always see the adults in sunglasses because it becomes a fashion item, but from a protective point of view, that's also important. And then dietary things, and diet is something that, you know, with all medical conditions, diet is important, and the eyes are not excluded from this. So a sort of a balanced diet, a healthier diet, less meat, less fried foods, more of the omega-3 type foods and less of sort of fried oil and sort of omega-6s and 9s. Those protect your sort of inner structures, the retina, from degenerative diseases later on in life.
Oh, that's very interesting. I want to ask something about retinal detachment. So I've got a friend, a fit guy. He's very healthy. He's 55 and he had a retinal detachment. In fact, I think you fixed him. Thank goodness, now I can see again. But are there risk factors? I mean, I don't know much about retinal detachment, and I thought maybe a fit, healthy oak won't get it, but I was obviously wrong.
So a retinal detachment is actually quite a common problem. If we kind of look at an incidence, we'd say maybe one patient for every 10,000 people. So that's not too rare. But there are risk factors, and they're more of an anatomical risk. So again, you can be a fit, healthy person, but if your eye has the predisposition to develop a retinal detachment, it's something that you may develop later. And the biggest risk is people who are short-sighted. So if your glasses have a minor script, in other words, you can see things better closer without glasses than you can at the distance. You need to wear your glasses for distance, and you're short-sighted. And short-sighted people, because of the anatomy of the eye, because the eyeball is physically slightly larger than the average and the retina is slightly thinner, you have a propensity to develop a retinal detachment. But retinal detachments can happen in anyone else. Often it can be predisposed by trauma, or we have a gelatinous body called the vitreous, which occupies a space in the eye, and as we age, that starts to liquefy and collapse in itself, and that can trigger a retinal detachment. So the retina is the nerve of your eye. It's the structure that, it's like the sensor of the camera, which sends the signal to the brain of what you're actually seeing, and without your retina, you cannot see. Which is why when patients experience a retinal detachment, they feel like there's this curtain that's coming down over their vision. As their retina is detaching, their vision is disappearing. Risk factors, things that you've got to look out for to say, am I maybe getting a retinal detachment, would be what we call flashes and floaters. A flash in the eye, it's almost like you feel like there's a light that's just popped in the room and keeps flashing on and off when you're looking around thinking, but hang on, I don't see anything. And you realize it's actually happening in your eye. And floaters are little black shadows that all of a sudden you see in your vision. You almost feel like there's a fly in front of you, and you try and swat it away, or like a hair's come down and you're doing that and you realize, well, hang on, there's nothing actually there. What I'm seeing is actually in my eye. So those are signs of a possible retinal detachment.
You see, you must start being nicer to these young, fit men that you meet, because you're leading to retinal detachment with them. You must be gentle with them.
Okay.
You must be gentle, Doctor.
Yes, Jeremy. Dr. Dory, I want to ask something else. I often have patients phone me, being the GP, phone me and say, I've got pink eye, or my child's got pink eye. Please, can you just script a eye drop for me? And they get quite irritated when I say, but I really need to see you. Can you enlighten us a little bit on just the common pink eye, or people who think they've just got pink eye, and what dangers there there are to look out for?
So the common pink eye is a viral infection. It's called a conjunctivitis. It's caused by viruses not too similar to sort of COVID. So COVID in itself actually can cause pink eye as one of the symptoms. But and on a whole, they're generally harmless. The eye can be a bit red, a bit weepy, a bit crusty, but it goes away. The risk is, and I'm glad you've asked this question because we get asked it also, if you can just script something, my eye's a bit red, is that if it's something benign and you've scripted some antibiotic eye drops, then nothing, then it's really not of great consequence. But if there was something else going on, and now you've prescribed a drop that not only maybe isn't indicated, but it's also contraindicated, it could make the problem worse, then you're dealing with a whole new problem, and you've taken someone who maybe had a serious problem and you've made it 10 times worse and they can lose their vision. I've previously seen this in exactly the case where a GP was asked to just script some drops for a child's red eye, and a week later the child almost lost all their sight because of a severe infection on their cornea, which was then not treated properly because it wasn't scripted properly. So I think that's a very dangerous sort of habit or practice, to just sort of script eye drops when you haven't seen anything. And I guess that would lead us to sort of say, well, when would we see the GP versus when would we go see an ophthalmologist?
Doctor, another, as a layperson, another common eye problem that comes into conversations is glaucoma. What kind of symptoms are you looking for there, and what would happen if this particular situation wasn't treated?
So that's a great question. Purely because glaucoma, as far as symptoms goes, is actually a very silent disease. So the patient often doesn't know something's wrong until you're very far advanced into the problem, and by then it's actually a little too late to try and prevent the vision loss. So when we talk about glaucoma disease, where the pressure in the eye, and this is the most common form of glaucoma I'm talking about, where the pressure in the eye increases, and that eye can't tolerate that increased pressure. So we've got to think of our eye as essentially a ball of fluid. It's kind of like a swimming pool. It has a pump that's pumping fluid in and a filter that's filtering the fluid out. And that regulates the water pressure in the eye. And if there's an imbalance between the two, then the pressure can build up. And it's generally a slow disease. It's a genetic disease, essentially, at the end of the day, and it affects people over the age of 40, but there's generally a family history in the most common form. If that pressure goes up, the patient can't actually feel it. But what that increased pressure is doing in the eye is that it's very slowly damaging the nerve. And the optic nerve is the most important structure in the eye because that's sending the signal of vision to the brain. And if the optic nerve gets damaged over time, you're starting to lose your vision, but you don't know it. And the reason why you don't know it is because when it starts, you're losing your peripheral vision, which is out here. It's vision out in your periphery, where when you're missing a small spot, you may not see it. But as it gets bigger, you still may not see it. Your brain is excellent at deceiving you that you're losing vision. And it takes a long time for the patient to actually realize that they've lost vision. And by the time they realize that they've lost almost all their vision and they're left with what we call tunnel vision, just this little small central tunnel of vision. So glaucoma is actually a silent disease in its most common form. Patients don't know it's happening, and they normally get picked up during a routine eye test at the optometrist, where the optometrist would check the pressure. And if there's any concern or any suspicion, they'll be referred to us to confirm whether or not there is a problem. You do get other types of glaucomas, more common in Asian people, really, and then sort of Caucasians, where you get a sudden increase in pressure, and it's a very high increase, and that causes a lot of pain and blurring, and that's what we call an acute angle closure glaucoma. But in South Africa, that is a lot less common. It's a bit more common in the Western Cape, but it's a lot less common than the sort of typical glaucoma that we see, which is essentially silent.
So we should see our optometrist regularly.
Yeah, exactly.
Mm.
Definitely. So that there's a good reason to have your eyes tested every couple of years.
Okay,
to screen
every
for these
couple of
things.
years. And then the last thing, just quickly before we have to end this, are there a few red flag symptoms that you would say people should look out for, which should make them go straight to the ophthalmologist? Bypass the GP?
Absolutely. Bypass, do not pass the GP, do not collect 200, go straight to the ophthalmologist.
Yeah, what do you mean collect 200? Pay 560 if you're lucky.
Exactly. So I think the first thing we touched on, retinal detachment. So if you get it, if you ever get flashes of light, you'll know what I'm talking about when you experience it yourself. It's like a white flash that's happening in the periphery of your vision in one of your eyes. Flashes of light or new floaters, new little mithies floating in your vision that you've never had before. That's a red flag. You've got to, whenever someone phones my rooms and tells my staff, I'm seeing flashes and floaters, they'll be surprised. They'll see me the same day because it's that urgent. Because if we can pick a retinal tear or retinal detachment early, it changes the outcome for the patient completely. Flashes of light, anytime when your eye becomes red and extremely light sensitive, that would be a cause for concern, can be inflammation in the eye, or any blurring, sudden blurring of vision that's not going away, or distorted vision. So if you start to see that you're looking at your Excel spreadsheet on your computer, everyone's working with computers these days, and all of a sudden the grid is starting to kink itself in and the numbers are starting to sort of curve, anything like that is a red flag for potential retinal disease and something that we'd like to get on top of quickly and treat early.
Dr. Dori Neuner, thank you very much for joining us on Mansfield today. It's been absolutely fascinating talking to you. And as I said, thank you for taking time out to join us.
Thanks, Dori.
Thank you, guys. Lovely to be on your show. Cheers.
Dr. Dori Neuner, who's an ophthalmologist at Fourways Life Hospital here on the Medical Show. We've got another vodcast coming out today on this Medical Wednesday. It's a little bit different to our normal medical stuff. You know the old saying, sleep tight, don't let the bed bugs bite? Well, we've got somebody coming up who actually comes and extracts bed bugs from your bed. Yeah, so we're going to be talking about that because it does lead evidently to a lot of allergies. We'll be releasing that vodcast as well today. Until next Wednesday on our next medical show. Thank you, Dr. Vicky.
Pleasure, Jeremy.
And we'll see you then. If you enjoyed the show, remember to subscribe. Have a good day. Bye-bye.